we're gonna get started with the endocrine system problem set. For question number 1, I have Ian. You may read the question. Yeah.
Yep. All of the following are true of the nervous system, except that it doesn't function independently of the endocrine.
Endocrine system, yeah. So all of this is correct. So all of these choices, if you see, right, these are true for the nervous system. I think we went in depth about the nervous system, the neurotransmitters it secretes, right, the receptors that it acts upon, right, but it does all of these except, right, functions independently. So it does not function independently. Very good. Number 2, we're going to go with Milan.
Norepinephrine and epinephrine are considered to be hormones when released into bloodstream, but neurotransmitters when released in synapses. So it'd be A.
A, very good. And in the lecture, I was explaining, right, the adrenal medulla. It basically predominantly it secretes epinephrine. I would say maybe 80% of it is epinephrine, which is the endocrine hormone that's being circulated in your blood. And then maybe 20% or maybe slightly less will be norepinephrine that it also secretes. But usually norepinephrine we see at the synapses as pointed here. I just want to show you guys, I think it's an important concept. I'll show you basically from the slide set that we did, where I had the nervous system here, right? So you see here, these are being the presynaptic terminals on this end, and this is being the postsynaptic terminals, right? So the postsynapses usually secrete, depending on if it's sympathetic or parasympathetic. Parasympathetic secretes acetylcholine, but sympathetic system secretes, right, norepinephrine, the one I'm circling. And if it's on the neurotransmitter portion of it, right, it will be on the synapse. If it acts on the same receptors, obviously the effects are going to be the same. Neurotransmitters usually act much faster. If the hormone has to circulate via blood, right, via endocrine methods, it will also exert its effects systemically, right, as pointed here. It's not going to be as fast, right? It has to circulate and then act on its target receptors. But this is important to know, right? Adrenal medulla, as I was explaining, about 80% of it will be in the form of epinephrine. Maybe about 20% of it will be norepinephrine. All right. So I'll go back to our question set. Number 5, we are going to go with Brian.
Blank are chemical messengers that are released in one tissue and transported in the bloodstream to alter the activities of specific cells in other tissues. I believe A, hormones.
Hormones is correct, right? So if it's released in one tissue and transported via the bloodstream, right? Anything that's you transport in the bloodstream will be via endocrine means, and so these will be the hormones here. So very good. Number 7, we have Ari.
All right, what we got here? So all target cells, I'm gonna say D, have hormone receptors and correspond to chemical signals.
That is correct, right? So think of it like this, you know, the model being, they say, like lock and key. So if you have like a receptor, let's say this is your beta 1 receptor, and here let's say this is your ligand that comes here and meets the receptor. This is your epinephrine, right? So as you could see, right, it binds into the receptor and then it exerts its effects like basically lock and key method. These ligands, right, or hormones, they are specific to the receptor, and whenever they create medications, the medications usually the form of the medications will take shape of the natural, right, hormone or the natural ligand that your body secretes, right? That's how they make, let's say, if they have a medication that mimics the sympathetic system, they'll call it sympathomimetic. and it's also going to mimic, right, the natural ligand, right, for that receptor. The same thing if you have, like, let's say a beta blocker medication, right, it will resemble the same receptor, and it will block it here, right, and will not allow the ligand to attach and to exert its effects, right. So the best way if you're going to learn pharmacology, and this is my advice, first learn what the endogenous ligand, or what the body secretes, and what receptor it works on, and what's the natural response. Once you know that, and I tell you the medication is a sympathomimetic, or it's a beta antagonist, or beta agonist, or alpha agonist, antagonist, you kind of have an idea. Okay, I know normally when epinephrine targets this receptor, this is the result, right? So if I block it, right, I'm not going to see those effects. If I have a medication that's basically mimics it, I'm going to see those effects. So the best way to learn pharmacology is basically learn this, and knowing your sympathetic system, knowing your neurotransmitters, right? So that's that. Number 8, we're going to go with Lida.
Hi, sorry, I'm
No problem.
updating my thing. Hormones known as catecholamines are, I think it's a steroid.
So catecholamines, right? So they're derivatives of amino acids, right? And usually they're derivatives of tyrosine, right? So if you know when you see amines, right, you want to think amino acids, amino acids.
True.
So here it will be choice D. Let me just show you from the slide set. I think it was earlier up. Right? So here we see amino acid derivatives, right? And we see an example of catecholamine here. They're showing you epinephrine. It has a catechol benzene ring essentially, and an amino acid, right? The tyrosine is one of the derivatives that it's is made from, right? 20 regular amino acids. So this is what we see. All right, we're gonna go back to the question set. Number 9, we're gonna go with we're back to E. If more of you guys want to participate, raise your hands. Otherwise, I will not call on you.
Peptide hormones are composed of amino acids.
Yeah, peptide are composed of amino acids. Right, very good. 15, we're gonna go with Milan.
When catecholamine or peptide hormone binds to receptors on the surface of the cell, the second messenger appears in the cytoplasm.
Yeah, second messenger. So what is the second messenger? Again, so let me go back to the slide set. I think it'll probably be shown here. So I think it was in the, G-coupled receptor. So for example, right, so you have different G protein coupled receptors, and you have specific hormones or ligands, right, like the overall name. And when it binds, it does certain things. So you may have a G stimulatory response, or you may have G inhibitory response, for example. And so here you see, right, the second messenger. So here we see G protein activated, and it acts on a second messenger, right, to activate, right, cyclic AMP, and you have increased production, right, of this, right, cyclic AMP. So this will activate secondary messengers, so downstream of the hormone. So this binds here, lock and key method, right, as I was explaining to. And depending on this G protein, right, you may have activation like G stimulator, or you may have G inhibitory, right, where it basically enhances breakdown of cyclic AMP. So an example of G inhibitory would be alpha-2 receptor, right, where you have norepinephrine coming to an alpha-2 and basically downregulating the release of it. And then let's say G stimulator will be epinephrine binding to the G protein and increasing, right, let's say chronotropy, dromotropy, and so forth of the myocyte. So what are the secondary messengers is basically all the cascades downstream, right, before you actually see that activation. All right. Next question we have so a double printed. So 15 is C, right, which we talked about. We're going to go with number 34. We have Brian.
The posterior pituitary gland secretes ADH,
ADH, right? Good. And what would be the other hormone that it secretes?
oxytocin.
Yeah. Oxytocin, right? So those two, I would say, are very important to note. Why? Because there's medications that mimic these, secretions. We do have actually vasopressin. It's going to be added to the protocol with the new changes. You're going to be administering as a pressor agent. So you want to know, right? It's antidiuretic hormone. Oxytocin. We used to have this medication in our formulary. It was for postpartum hemorrhage, right? When the fetus was delivered and the uterus was still boggy and was continuing to bleed. So he gave this for uterine contraction and hopefully for delivery of the placenta. If you do L&D rotations, right, labor and delivery rotations, you will see this medication, right? They usually hang it as an IV drip you'll see it hanging. They could use it as, right, inducing labor. And the other one is also for hemorrhage. So stopping hemorrhage. So in the hospital, you'll see this quite often in L&D, right? So good. 37, we're going to go with Ari.
The hormone oxytocin does all the following except, I'm going to go with E, is responsive to osmoreceptors. That's ADH.
Correct. So for 37, E is correct choice. Excellent. Lita, we're going to go with you for number 38.
Growth hormone does all the following except D, promote amino acid uptake.
So let's think about, right, the effect of growth hormone, right? So do you think it causes fat accumulation within adipocytes?
Oh, maybe not within adipocytes.
Yeah. So the thing here that it does not do, right? It does not, right, cause fat accumulation within the cells. But the other ones, bone growth, muscle growth, and amino acid uptake, it does. It also is one of the counter regulatory hormones. And it's secreted, right, when the body perceives there is I should say, low amount of glucose, right? And that could be because you have lack of insulin as well, right? And the body perceives that as low amount of glucose that's in the cell, so it's secreting it as part of the counter-regulatory hormonal response. But in terms of this question, number 38, which it does not do, right? It does not accumulate fat, right, within adipocytes. All right, number 38. Well, we got that. Number 39, we're going to go with Jackson.
Number 39. The pituitary hormone that triggers the release of the thyroid hormone from the thyroid gland is TSH.
TSH is correct, right? Thyroid stimulating hormone. So this is part of our anterior pituitary, right? And we see it, right? So TSH, thyroid stimulating hormone, A, very good. 40, we're going to go with Kayla.
The pituitary hormone that controls the release of steroid hormones from the adrenal cortex is ACTH.
ACTH, right? Let me go to the diagram just to show you guys all these things. I think it's easier to see on the pictures. Right. So here we see the anterior lobe, right, of the pituitary, right? We just talked about thyroid stimulating hormone, right, and ACTH, adrenocorticotropic hormone, right, which will act on the adrenal gland for its secretions, right? By the way, just to reiterate, right, the thyroid thyroid gland, its own secretion, right? We talked about it has calcitonin for calcium control, and parathyroid has parathyroid hormone for when you have low calcium levels. But the thyroid itself, it secretes T3 and T4. This is basically, T3 is usually the active form, right, of the thyroid hormone, and it's basically the major hormone for metabolism, right? And you may have conditions, right, where you have oversecretions of this. When you have, for example, like Graves' disease, you're going to learn more in depth about that in your paramedic lectures. But thyroid gland, right, besides the calcium control, it also secretes T3, T4, T3 being the active form of it, right? Thyroid. And the effects you see, right, increased metabolism, increased temperature, right? Some of those things, increased heart rate. All right, so let me go back to the problem set. 40 was B. 41, we're going to go with back to in.
Hold on. Okay, there we go. The pituitary hormone that promotes egg development in ovaries and sperm development in testes is C, FSH.
You saying C?
Yeah.
So FSH is a follicular stimulating hormone, right?
Follicle. Yeah, that's why follicle and egg. That's right. So
but here, right, and sperm development, right? So it's not the follicular. It's the
okay. So is it? I don't know.
You don't know? I was trying to see if I could get you off track. You're actually correct, right? So if you know your stuff, right, stick to your guns, right? So it is the FSH, right, follicular stimulating hormone, right? The other ones actually do not make sense, right? Because if you think about it, right, what are the other ones, right? One is a thyroid, the other one works on the adrenal medulla. This is for your testosterone production, right? And growth hormone is for what? Growth hormone is for bones, right? And muscle mass, right? Production, uptake of amino acids, and so forth. So stick to your guns, right? You know your answer, stick to your guns, right? And just to show you guys the picture, right? So follicular stimulating hormone, right, will stimulate, right, this, and for sure, right, and also the luteinizing hormone, the LH, will be the production of testosterone. So LH is testosterone. This is also, I want to say, I think one of the important factors when you guys are taking your exams, I look over, right, I see quite often you guys erase your answers and then you put something else. And oftentimes you change the correct answer to an incorrect answer. Unless you're 100% sure, right, when you're making your change, that it is in fact you made some error or you found something in your text, right, as you were reading further, only change your answers then, right? Otherwise, do not ever change your answers. This is just a good strategy. And if you know your stuff, right, stick to your guns, right? So for 41,
are you talking about our scan?
Yeah, I'm looking exactly, because the reason why I look at your scantrons is because sometimes, sometimes what may happen if, let's say, you bubbled and erased, sometimes the machine may erroneously think like, it marked that answer. So I check just to make sure, right, there's no errors. So making sure you guys get all your points. But oftentimes what I noticed is that when you erase an answer and you put a different answer, oftentimes you choose the incorrect one. So initially you had the correct choice. So I would say by statistics alone, the moment you select an answer, stick with it, unless you're 100% sure, right, you made an error, like you misbubbled it, or something along in the test you found. Maybe you were like reading a question and that question told you, something that, you remembered, like, oh yeah, that was the correct answer, right? Or sometimes, a next question will tell you an answer for the previous question. It could happen. So only then change your answers. Otherwise, do not. Right? And if you know your stuff, right, stick to it. Like, don't let me, take you off the course. All right, 42. We're gonna go with Milan.
The pituitary hormone that promotes ovarian secretion of progesterone and testicular secretion of testosterone is D. Whatever it is, LH.
Yeah, luteinizing hormone. Luteinizing hormone is correct, right? So yeah, that's the correct choice. 44. We're gonna go with Lita.
The pituitary hormone that stimulates cell growth and replication by accelerating protein synthesis is growth hormone.
Excellent. That's your favorite hormone.
Yeah.
Right? Now you're not gonna make a mistake, right? So growth hormone, right? We see it in bone development. We see it in muscle development. We see it in protein uptake, right? So very good. 44 is E, right? And again, as just to reiterate, it was one of the counter-regulatory hormones that we learned. All right, 45, we're gonna go with Jackson.
The pituitary hormone that causes the kidney to reduce water loss is
So another term for reduction of water loss would be antidiuretic, or right, no diuresis. So which of these hormones do you suppose will stop diuresis from occurring?
It's not TES. I know that. It's FSH. No, wait.
So FSH is follicular stimulating hormone. It stimulates the follicle, right? TSH is thyroid stimulating hormone. OXT is oxytocin, right? This was the adrenal gland, right? Adrenocorticotropic hormone, and ADH is antidiuretic hormone. So out of these choices, E is the correct choice, right? So remember, essentially the posterior pituitary hormone that causes the kidney to reduce water loss, right? So it's acting as antidiuretic, right? So if we stop losing water, it's basically acting as antidiuretic, because right, if you take diuretic medication like Lasix, right, it's gonna cause you to pee out more, right, or diurese more. So if you have a hormone that reduces water loss, it will be ADH, right, antidiuretic hormone. Another name would be vasopressin, which will be in the medication formulary. By the way, in your paramedic formulary, right, there's also something called furosemide that's I was just talked about, right? That's the trade name, and you have Lasix, right? Do you know why they call it Lasix? These are the same medications, just trade and generic name.
Because it lasts, is that what it is, lasts 6 hours?
Yeah, it lasts 6 hours, right? But it may last 6 hours, but the moment you give this IV, right, you better make sure you either have a bedpan or a urinal for your patient, because they're gonna urinate all over the stretcher, right? So if you're gonna give this medication and you call for it and you got, to give it IV, make sure you have a urinal or a bedpan ready to go, right? Otherwise, they will diurese all over your stretcher, right? So yeah, last 6 hours, furosemide. This would be in opposition to this, right? So ADH will be antidiuretic, right? Hold on to water. Lasix, furosemide will promote diuresis. This medication was given for those patients who had like congestive heart failure to diurese them, but we found out, in a pre-hospital setting, because we don't know their electrolyte status, we don't know if they're, high potassium, low potassium, calcium, magnesium, and so forth. You want to be careful, right? Because you also lose, potassium along with it. So you got to be careful when you give this medication that you don't alter their chemistry, blood chemistry, too much. So they usually reserve this to be given in the hospital setting. All right. 46, we're going to go with Kayla.
Changes in blood osmotic pressure would most affect the secretion of is it also ADH?
Yes, correct, right? Just osmotic pressure, right? So think of it like this: all the particles that are found right in your blood that basically cause that pressure. So if you give antidiuretic hormone, right, you reduce excretion of water, right? So more water is going to be there, right? So this will alter your osmotic pressure. If you pee out more, you maybe become hemoconcentrated, right? If you retain water, you become more dilute, right? So ADH will basically adjust your osmotic pressure. By the way, just so you know, that there may be patients, right, who may have issues with ADH secretions from two opposite directions, right? One be nephrogenic, right? And the other one can be essentially from the posterior pituitary. So they call it CNS, or I should say neurogenic, right? So you may have neurogenic cause, and you could have nephrogenic. So neurogenic would be, right, your brain, right, essentially the posterior pituitary, and nephrogenic is essentially your kidney, right? So what's going on here? So you may have a patient, right, who, for whatever abnormality that's causing it, right, is not secreting ADH from the posterior pituitary, right? So if they're not secreting ADH from the posterior pituitary, right, they're not going to retain water, right? So if they're not going to retain water, they may be, eliminating a lot of urine. On the other hand, ADH may be secreted by the posterior pituitary, so it's making your ADH, right? But the receptors on your kidney are not working properly, right? So where the ADH binds on your kidneys. So the effect is the same, but the cause of the problem differs, right? Is it neurogenic, meaning is your brain posterior pituitary secreting it, right? Or if the cause is nephrogenic, right? The receptors are not functional on your kidney. So this is just some of the locations where this may exert its effect. Okay. We are, I think, up to Christina for number 47.
The primary function of ADH is to decrease the amount of water lost off the kidneys.
Very good, right? B, decrease the amount of water loss from the kidneys. Excellent. 50, we're going to go with Lindsay.
Hormones that may be slowly administered by intravenous drip to accelerate labor and delivery is oxytocin.
Oxytocin is correct, right? So induced labor, right? You will see this in the hospital setting. You are not giving this in pre-hospital setting. You're not inducing labor. But note that we did have this medicine, right? But it wasn't for induction of labor. It was more for postpartum hemorrhage. So good. 51. We're gonna go. Next is, but back to Ian.
After brain surgery, a patient receiving post-operative care in an intensive care unit begins to pass large volumes of very dilute urine. The IC nurse administered a medicine that mimics which of the following hormones? I put ADH.
Yeah, ADH is correct, right? So this essentially, you want to counteract the response, right? So if the patient begin to pass large volumes of very dilute urine, they're not concentrating their urine, right? So perhaps, right, they could have, an issue with, let's say, neurogenic, right, cause of no ADH production, right? So let's say they're not producing any ADH. So if they're not producing any ADH, as I was just explaining here, right, about neurogenic or nephrogenic cause, so let's say they're not making any, right? So the posterior pituitary is not making it. They find they make a lot of large volumes and they're fully catheter, right? So then they could give him ADH. By the way, what would that medicine be called? Do you know, Ian?
No.
Right, vasopressin. All right, 52, Milan.
The testes produce testosterone.
Testosterone is correct, right? Yes, very good. 53, we're gonna go with Jackson. Jackson, are you there? All right, we're gonna.
Sorry, I was doing this video.
No problem. We're at number 53.
The ovaries secrete blank when stimulated by FS. The hypothalamus. Wait, I'm
I don't think that's one of the choices, right? But just to
I
help,
was
huh?
looking at the wrong answer. My bad.
Okay, so the ovaries secrete estrogen, right? That's the hormone they secrete when they stimulate by follicular stimulating hormone, right? So estrogen is the correct choice for number 53. 55, we're gonna go with Kayla.
The posterior lobe of the pituitary is also known as the neurohypophysis.
Correct, right? Right, very good. And Christina for number 56.
The anterior lobe of the pituitary is also known as the D.
D, adenohypothesis, yeah. So let me go back on this diagram. And I had it here, right here, right? So the posterior lobe, right, is called neurohypothesis, and the anterior lobe is called adenohypothesis. This is just basically the same names, stating, right, anterior lobe versus posterior lobe. The reason why, I want to bring these up, sometimes on the test, they'll say, your neurohypothesis secretes the following hormones, right? And, they will say FSH, LH, oxytocin, OXT, right? And maybe GH, right? So then if you're not sure what the neurohypothesis means, you will not be able to, say, but as long as you remember posterior lobe, right, secretes oxytocin, secretes ADH, that's the neurohypothesis. Your anterior lobe is adenohypothesis. If you remember, right, A starts with A, and anterior A, right, adenohypothesis. And these are all the hormones, right, it secretes from the anterior pituitary, right? So good. All right, so let me go back to the problem side. 66, we are up to Lindsay.
Which of the following is a known effect of thyroid hormone on peripheral tissues? All of the answers are correct.
Yeah, all of this is correct, right? So we just talked about thyroid hormone, right? Specifically, right, secreted by the thyroid gland, T3, T4. T4 then converts to an active form of T3, right? And, right, increases oxygen consumption, heart rate, right? Adrenergic stimulation, increased body temperature, increased metabolism. So all of these choices would be correct. Good. 67 is the next one. We are going to go with Larry. Larry, would you like to go 67?
Thyroid hormone contains the element of D, iodine.
Iodine is correct, right? So when they say like T3, T4, right, usually T3 has 3 iodines on it, T4 has 4 iodines on it, right? And yes, that's the element that is contained, right? 68, we are back to Ian.
Okay. You said 63?
68.
Okay. All the following are result of thyroid hormones except E, stimulation of red blood cell.
So it does stimulate formation, right? But except, right, you will not see a decreased heart rate and force of contraction with these. Right? Why? We just said, right, it was all stimulator, right? Remember we said it was increasing oxygen consumption, increased heart rate, increased sensitivity to adrenergic stimulation, increased body temperature. So out of all of these, the best choice, right, except, right, it does not have decreased heart rate. It will have actually increased heart rate in this case, right? 69, we are going to go with Milan.
The hormone that plays a pivotal role in setting the metabolic rate and thus impacting body temperature is thyroxine.
Thyroxine is correct, right? Secreted by the thyroid gland, right? So yes, this is what we were just talking about. So thyroxine is correct. 70, we are going to go with Jackson. Yes. Would you like to go?
Yeah. The thyroxine and
calcitonin, right? Calcitonin, right? Remember, this was with the calcium, something to do with calcium.
Are secreted thyroid gland.
Thyroid gland is correct, right? So remember, calcitonin, right, was when you have high calcium in the blood, right? I was telling you guys normal range is between 9 to 11 milligrams per deciliter. When it exceeds, right, 9 milligrams, right, calcitonin will basically be secreted by the thyroid gland to basically reduce, right, the amounts in the blood. How does it do it, right? Bone will absorb it. It will increase secretions in the nephron, right, in the kidney. So you'll pee out more calcium. So thyroid gland is responsible for both thyroxine and calcitonin secretion, right? 73, we're going to go with Kayla.
A hormone that can lower blood levels of calcium ion is C, calcitonin.
Calcitonin is correct. Yeah, I basically just talked about it, right? So yes, calcitonin is correct. 76, we're going to go with Christina.
Increased levels of the hormone will lead to increased levels of calcium ions in the blood. Is it calcitonin?
So we just, calcitonin is when you have increased calcium, right? And it will basically lead it to reabsorb, right? But when you have the following hormone, it will increase. So basically think what I have, right? Yeah, I have now low levels of calcium. So my number is, let's say 8 milligrams per deciliter. And I want a hormone to come out that will increase my levels.
So is it C?
C is correct, right? And so it's parathyroid hormone. And what secretes this?
Low calcium level.
No, which gland?
Thyroid?
Not the thyroid, but
I don't know. I'm confused.
Okay, so let me go back to the image then. Right, so look, so this is your thyroid gland, right? And this is your parathyroid glands. You see the small ones on it, right? So these are the parathyroids. This is the thyroid, right? And then we are going to talk about very briefly, right, about calcium homeostasis, or how it works, right? So we just talked about when you have high calcium levels, right? The body wants to either move it to the bone or excrete it. So what does it? It does it via calcitonin, what secretes calcitonin, and it's secreted by, right, the thyroid gland. And the way it works, right, it works on the digestive tract, it works on the kidneys. So you could have, if you have high calcium levels, one thing you can do is basically have increased excretion. You basically pee it out, right, in the urine, or you could have calcium absorption from the digestive tract is prevented, right? So you less of it is absorbed, right? But on the other hand, let's say your number is 8 milligrams per deciliter, you have hypocalcemia. What happens then is that these parathyroid glands, right, they secrete the parathyroid hormone. And their job is to basically increase the amount of calcium in your body, in your bloodstream. How does it do it, right? It works on the kidneys, bone, digestive tract. So one thing you can do is it will increase the reabsorption of calcium in the kidney. So less of it is coming out on the urine, you're peeing out less calcium. Your bone is resorbed. Basically, you break down bone and you release calcium, right? And then you have calcitrol production in the kidneys, right? To cause absorption in the digestive tract of the calcium. Why is calcium important for us? Can anyone give me an example? What can we do with calcium?
Because it raises the threshold, the action potential. Right?
Yes.
No, the threshold potential in a setting of hyperkalemia.
That is correct. That is when we give it as a medication, right? Very good. But what does it do on, like, for us as a normal, ion in the blood, right?
Muscle contraction.
Muscle contraction, right? Very good. And something else, anyone can tell me? We learned that in the neuro chapter. So muscle contraction, right? When you have myosin docking to the actin filaments, right? And some very good thing to remember, right? Calcium oftentimes stimulates exocytosis of either a neurotransmitter or some other hormone, right? In endocrine side of it, calcium, when enters it into the beta cells of the pancreas, this will stimulate secretion of insulin. So calcium stimulates secretion of insulin. In the neuro chapter, calcium is what stimulates the release of, let's say, acetylcholine, right? Neurotransmitter, to produce its effect on the motor end plate, right? So calcium, if you want to remember, right? Muscle contraction is one thing. Two is exocytosis of either hormone or a neurotransmitter in the body. All right. So we got to number 77 now. 77, we are, I think we're up to Christina.
I just went.
Oh, okay. So then we are up to Lindsay.
The hormone that does the opposite of calcitonin is the parathyroid.
Yeah, that is correct, right? Parathyroid hormone. 78, we're back to Ian.
The parathyroid glands produce a hormone that B increases the level of calcium ion.
Yes, B is correct, right? I think now you guys are expert at this. 80, Milan.
Before the discovery of these glands, thyroid surgery often led to a rapid drop in blood calcium levels, which triggered muscle contractions and cardiac arrhythmias. What glands are these and which hormone is lacking?
Basically, it's saying which of these control calcium.
So parathyroid glands and calcitonin?
Well, the parathyroid gland will be, right, it doesn't secrete calcitonin, but
Parathyroid hormone.
Right. Just let me go back to the, right. So remember, right, the parathyroid gland, right, it was secreting parathyroid hormone.
Okay.
And calcitonin was here, right? Calcitonin was on the thyroid. Okay. So here, 80, choice C, right? The parathyroid gland and the parathyroid hormone. All right. 84, we're going to go with Jackson.
The adrenal medulla produces adrenaline.
Which one did you say?
Epinephrine. So
Epinephrine is correct, right? So adrenal medulla produces epinephrine, about maybe 80% of it, and 20% would be norepi. Norepi about 20%. Let me see if I have a good picture here. I think I should. Right, here you go. Right? So here you have the adrenal medulla, and this secretion, right, from it is the epinephrine and norepinephrine, right? So one was, we said, was endocrine hormone secreted in the bloodstream. The other one was a neurotransmitter.